Welcome to the Dogish podcast, the only podcast dedicated to the topics, events, and personalities impacting parents today. My name is Jasen Arias, founder of Forever USA. Sadly, we do not have Miss Sylvia West today. She had a emergency that she had to go tend to, so she's off being a bit of a hero. But who we do have with us is Michele and Julie from the TMCC Veterinary Nursing School. And we sit and talk about some absolutely incredible topics revolving around the idea of vet techs and who you're working with in the veterinary community and what the difference is between a veterinary nurse and an actual veterinarian, some of the decisions that are going on there, how to get involved, all sorts of crazy things like that. It was a really powerful episode. I hope you guys love it. So let's just go ahead and hop onto it. Well, welcome to the show, guys. It's good to see you.
Thank you.
Hi, Jasen.
It's been a little bit since we got to hang out.
Yes.
We
had a long summer, a long hot summer.
I know. I met for everybody, to catch everybody up real quick, I met Michele when we were doing an art installation over at TMCC, and she really kind of opened my eyes to I was saying earlier, the unsung heroes of the veterinary community. And I wanted to bring you guys on to help us tell our followers and our listeners what that's all about. So maybe kind of start with who you guys are and what your backgrounds are, and then we'll kind of go from there.
Okay. I'm Michele Noreen, and I am a veterinarian. I am a graduate of North Carolina State College of Veterinary Medicine, and then I've been in the role of director, academic program director for a veterinary nursing program here in Reno, Nevada at Truckee Meadows Community College. And we recently changed our name to veterinary nursing, so people might know our profession as a veterinary technician. So, and then I'm here with my colleague, Julie McMahon.
Hi, I'm Julie McMahon. I'm a licensed veterinary technician here in Reno. Have a long history here. Started in a practice next to my house back in 1988. And literally was just, cleaning cages, mopping floors, walking dogs.
You started a practice next to your house?
Yeah, I grew up next to a hospital. Yeah.
Oh, okay.
So, yeah. So, over the years, it's been my career. Some people think of this type of work as a job or a stepping stone to something else. And for me, since I was literally 12 years old, it has been who I am.
That's what you've done.
Yeah, that's what I've done. So
maybe you guys can clear up a couple things, just even listening so far.
Sure.
Like, what are the levels? So like, you've changed your name, instead of just vet tech, now it's veterinary nursing, but then there's the veterinarian. So I mean, like, who are all the players that are involved in veterinary medical care, or like help me with some of the terminology?
Sure.
So it's the basic that most people think of the veterinarian in the veterinary hospital, but yeah, it's a lot more involved. The veterinarians really don't function without the veterinary technician. There's an initiative to change the name from veterinary technician to veterinary nurse, because technician doesn't quite encompass, it seems, everything that this support role does. It's really the right hand to the veterinarian. In the veterinary hospital, though, we also have to give credit. We have veterinary assistants. Okay. So they help the veterinary technician or veterinary nurse. And then we have the background, like Julie started out working in the kennels. So there's basic care of animals, especially if a veterinary hospital has a boarding facility or something like that. And then, of course, the receptionists, they're really the face of a practice.
Yeah.
So that's the basics of a small companion animal practice. Some of our hospitals have really become large, and a lot of different people physical therapy and specialists.
I was just gonna say, like, what do you like? And I would assume that there's other specialists as well. Like, so you've got like a general, like, and maybe I can help understand this more just from a layman's medical. I mean, like we've got a general practitioner, right? So like that's your doctor that
Your
you
family
go to
doctor,
normally, right?
yeah. Mhm.
But then there's like specialists as well, as far as like if there was something wrong with the brain or the spine or like,
Correct.
Well,
is that
and
true or no?
yes, generally we think of veterinarians as being specialists. So yes, you can be a general practice veterinarian and then go on for further training to do a residency, an internship, then a residency and specialize. But we also have specialists in the veterinary nursing field, which Julie can talk more
Yeah.
about.
So and in general, your specialty practices or breakdowns of major ones would be, well, dentistry. I'm just going to say that because go team, go dentistry. But so on the veterinary aspect, it's dentistry, surgery, cardiology, internal medicine, physical therapy and rehabilitation. I mean, the list goes on and on. Like there's numerous levels of where you can really focus your passion in. And it's very paralleled in the technician side of it. And so we have a group called the National Association of Veterinary Technicians of America, and they basically help us regulate the path to becoming specialized in something specific. And so for us, there's opportunities, again, go dentistry. You can be a veterinary technician specialist in dentistry, surgery.
Like Julie is.
I was picking up on that. Like that must be where the cheering crowd's coming from.
You can focus on just anesthesia, because as veterinary nurses, we're a very key part as what we consider an anesthetist, where we are vital in the roles of with animal anesthesia. There's radiology. There's tons. I mean, I think there's now 18 diversified specialties for technicians.
So as a baseline, how many of those, and I mean, I don't need like an exact number.
Sure.
So Reno, we're a little under, I think 500,000 people here. What are we like for? Like, how many of those specialists do we have here in town? Is that something that you're only going to find in the big cities? Because I've heard like friends and other people talk about needing to go to UC Davis for things like that.
So from the veterinary aspect, it's a fairly small community in the Reno-Sparks area. We have a couple surgeons. We have cardiology, internal medicine, physical therapy, and rehabilitation. Much beyond that, we're fairly limited and do still have to travel to the regional locations in Sacramento, Davis, or even sometimes the Bay Area. As far as the technician aspect of it, there's probably, honestly, I don't know how many, but I would say it's probably fewer than 10 of us in the Northern Nevada, Northern California region that have our specialty within our areas.
Okay.
So.
Okay. All right. So back to, like, I could sit and ask these kind of questions all day. Yeah. It's fascinating to me, because I think it's, we run into this thing as pet parents, and I mean, even taking care of our own health, that we don't have the answers to hardly any of these questions until it's an emergency. Yeah. And then I don't know that that's normally when we're making the best decisions, when we're underneath, emotional distress, and we can't hear from our animal, like what they're going through and what they're feeling. And a lot of times we're having to make these decisions last minute. So trying to know some of this stuff up front. And we've talked to vets too, but I'm fascinated to hear on your guys' side of things, because there's not a bias. Like, you're at the beginning, you're at the training side of things. It's not a bias of like, well, this is how we do things in our clinic, and we shouldn't do things like that clinic. But I know, like, we've been in veterinary offices when we're losing animals, or a friend's losing an animal, and you're not allowed to be with them sometimes, and you are other times. And like, trying to understand, like how do we make those investments and insurance? Like, this is such a huge topic.
Well, I have to say first, it really is important especially when you are in an emergency situation, that as a dog parent, that you have a regular veterinary hospital that you go to, that you're established somewhere,
Yeah.
and they know you. Even if it's just going for an annual exam, with younger, healthy animals, it's really important, because then you are establishing relationships, so that then when it is an emergency, yes, there are emergency hospitals that fill in, which are great to go to. But I think it really is important establishing a relationship with a veterinary hospital, with the whole team at the veterinary hospital.
Well, and that's one of the things we've talked about too, is not limiting it to going in just when there's an emergency. Going in, like even on the other extreme of things, going in just to say hi, so that your animal is more comfortable in that environment and not always under stress every time that they go in there.
Yeah, that's huge.
Something
We've
has to
been,
happen.
as a profession, we've been trying to move that way, in the sense of trying to reduce the overall stress for the animals. We're learning more about simple things like how we handle and restrain them during their visits, and like you said, desensitizing to them, and making it a positive visit, letting them walk through the hospital and get treats and positive feedback. As first, kind of leading to your question of how to help owners better understand themselves, the situations they're in. It does really go back to regular routine care for your pet, even when you feel like they may not need anything, because part of that routine care, especially in a family practice, is going to be education. And the people who are giving you that basic information about your animal's wellness, and it could be development, behavior, there's numerous things that it can fall under, but it goes back again to not just the veterinarian, but a large part of the support staff, either your assistants or technicians, are your first line contact. We're doing the face-to-face. We're in the exam rooms for a majority of those exam appointments or vaccine appointments. We're doing that conversation and helping with the educational information. And so I guess the short answer being is that preventative is huge. It's very important. Even when you feel like your pet is healthy and may not need the things that we always recommend, but preventative makes a huge difference to maybe not have you in that situation where you are, because I work in emergency part-time. So I see a lot of what you explained, having to make that heart-wrenching decision with just a little bit of information, and literally sometimes no time to even make what you would consider a rational choice. So I think it just goes back to just that common education and being consistent in what you would do. And like you said, it's hard enough for your own health, but sometimes I think we treat our pets better than we treat ourselves. So
well, and that's been something that I've become very aware of, is that for many of us, the emotional weight that a pet can carry into our lives as a family member is often just as deep as an immediate typical family member, and trying to make some of those decisions. The difference is that when you go into a hospital, if you can't pay for a teeth cleaning or something, like that's not a good example. If you take your family member into the hospital, they're not going to let them pass away or die if you can't pay your bill. But I mean, isn't that the decision that we're kind of faced with, like either euthanasia or paying the bill in certain circumstances?
Absolutely. Yeah. And that's probably the biggest reason why there's so much negativity or negative feelings, especially associated towards emergency facilities, is because it's difficult. One is that we as a profession are not a non-for-profit organization.
Right.
We are a for-profit profession. And then you go into the aspects of, you have to pay for the facility, you have to pay for your staff, you have to pay for the materials and goods to be able to provide the services that we do. And so there is this really disheartening balance between the financial capabilities of a family and whether or not they can make the choice to save them. There are resources, but again, a lot of it goes back to preventative. For instance, parvo puppies. It's cheaper to go get a $20 vaccine than it is to pay thousands of dollars to try to save their little lives. And that one is a big one. We see that in emergency a lot because it's a preventable disease that could have 100% been avoided by a little bit of education and a little bit of vaccination. And I would say statistically, a third of these animals get euthanized strictly for financial purposes. So yeah, it's a fairly decent number, but again, it goes back to that we're not a shelter. We're not a not-for-profit. That's a big part of it, which people don't take into consideration. No, but we don't have government backing. We don't have insurance companies. There's getting to some of that is moving. Like for instance, some of the pet insurance companies are now starting to do direct payment to clinic, which is huge for some families, right? Because who has $3,000 out of pocket to pay for something? And so if their pet is adequately insured and paying, then they just meet their deductible and then they're good. And I think that's the direction that we as a profession will end up moving, but it's still, it's difficult. And I've been faced with that. In my career for years and years.
I've never envied being on your side of things, trying to work with a family making those decisions.
No. And the reality is it's us, it's the support staff, it's the assistants, the technicians, the customer service representatives that are having to go through that with them. The veterinarian will, give them the information to help them make the best decision. But then a lot of that's left to us as support staff to help them figure out, can they financially figure it out? And if they can't, what's the next best step?
That was one of my first experiences when I was a vet assistant before I went down the road to go to veterinary school. And a family brought in a puppy, husky puppy that had been playing, the other dog. It's the puppy's eye prop toast, so it came out of its socket from the roughness of the other animal. And so my role was that I was just adding moisture to that eye that's now out of its socket while the veterinarian was talking to the owners and coming up with a plan. And they didn't have the money, and they didn't want to put the money into the surgery then to either remove the eye or put it back in. And I remember spending all this time with this puppy, and then the choice was made that they euthanized the puppy.
Jeez.
And it was really frustrating because I feel like sometimes people too, they can spend a lot of money for a puppy and all the things that go along with it, but then aren't prepared for the emergency medical care. So that's a whole other.
That's tough.
Yeah, it is. It's a really hard.
Yeah.
It's tough. And then, we're ending up, and I know you guys wanted to talk about the impact that the last year and a half, almost 2 years that we're going on with COVID has had. But that plays into not just the staffing that we'll talk about, but also the financial. If you don't have it, you don't have it.
No.
Right.
And you kind of briefly brought up a point, Julie, that I just learned about, is that the insurance, if you have insurance, most of the time it's a reimbursable. It's not an out of like you still have to have the money in your account to pay for that service, and then you get the money
reimbursed back. Yeah.
And so,
that's assuming that they don't nitpick it and say like, oh, well, this part's covered, but this part's not, or none of it's covered, or so on and so forth, because it's very much like human medicine in that aspect, that they will audit the medical record and then find what they determine as a justifiable treatment or medications.
Yeah. So this is it.
And
it's tough.
These are good examples too of how the reality of practice is really tough. And we are training entry-level veterinary nurses, and it's, we give them experience by they go and shadow in different hospitals, at our local animal emergency and specialty center and our other emergency specialty hospital. So the students get exposure, but it's really hard to prepare them also for these tough aspects of being out in practice. And to balance it as well, there are really tough aspects of being out in practice, but then there are very rewarding aspects as well.
Okay, so maybe like this might be a good time to talk about like, so you guys are training, well, I mean, what I would consider the front line of the veterinary community, right?
Yeah,
Yes.
a big part of it.
So,
Yes.
yeah.
And they're the ones that, like you mentioned, they're the ones that are having to deal isn't necessarily the right, but communicate and work with these families and these animals. Like the vet typically isn't, and no slight to any vets out there, but the vet isn't the one that's sitting there putting eye drops in the animal's eye while their owner's trying to figure out to pay the bill or not pay the bill. You have somebody that could be fresh out of school, or you have somebody that is trained, like sitting there with these animals going through and you're in, sorry, I know I'm jumping all over the place, but my brain is just like you're in this industry because you love animals so deeply.
Yes.
And having to go through very similar emotions as the owners that may sometimes not care as much as you care about their animals.
That happens too, definitely.
I see that. Yeah, I do. And you kind of gave me goosebumps when you said that, because sometimes you're the bond that you form with a patient in such a short period of time can forever change you. And it's easy to get emotionally involved, and it's not uncommon on a weekly basis for any one of us to lose it, just go in the bathroom and cry until you can't cry anymore, or you're feeling the loss of that pet as much as the family is when you go in to help them euthanize them. So there's this, and I think in general, it's we as a profession, people who choose to do this are, I guess, more empathetic, I guess is a way to say it, or empaths, I think is the term, because there's this, like you said, strong attachment to the animal world. What a lot of people don't realize, though, is that just because you love animals doesn't mean that you're going to, get to love puppies and kittens all day long. You're going to see some heart-wrenching situations, and whether that be, sadly, just circumstance of the pet either being injured or ill or has cancer or whatever. And on the opposite of that, some of it's just straight up neglect. It's human behavior that these animals are suffering because of people. And so you go through all these emotions. You go through some sadness sometimes, and then there's other times where you're so angry that you just want to say and do bad things to the human that let this come to fruition. So the emotional aspect of it is heart-wrenching, and we feel, like you said, we feel that emotion right along with a lot of these families.
And to be fair too, Julie comes from working in emergency and critical care. A lot of our graduates also go out and practice in, small animal hospitals and don't see the emergencies. So they do see the good things that are happening in the lives of those animals and get to know them. So there are, super nice owners and really well cared for animals as well. So we do have the spectrum, but it's a challenging profession, just like in human healthcare. And the push really has been for the focus for well care for us humans. How do we share experiences that are tough so that the team works it through? We emphasize in school communication and communication with the team. And when you have something that's really bothering you, something that happened, that you talk through it, and that you have breaks from veterinary practice, that you have a world outside and support systems, because that's really what the emphasis has been in the past few years of well care for the givers, for the caregivers.
So back to the topic a little bit about what you guys are doing now. Like, you guys are responsible for the training of the people that are getting involved in, and this is training that you have to go through even if you want to end up becoming a vet. Is that correct?
This is one
No.
of the paths, yeah,
Okay.
but not totally.
We could train a veterinary nurse that would go on to veterinary school, but it's a standalone career as well.
Okay.
And we train, again, veterinary technician, veterinary nurse, we're using interchangeably at this point. But we are an accredited program from the American Veterinary Medical Association. There's a committee of veterinary technician education and activities that oversees, that sets a curriculum, that sets the skills that students need to have. And we cover a lot of different topics in the 2 years that the students are with us. They're with us for a fall and spring semester, and then second year fall and spring. And we have classes like animal anatomy and physiology, medical terminology. We do a lot of math, medical dose calculations. Students learn how to handle animals and read behavior, and all of the things that are involved with animal nursing, of setting IV catheters and administrating fluids, medications, bandage changes, wound care. The students learn about pharmacology, all the different drugs that we use. Big emphasis, like Julie mentioned before, for anesthesia, because basically the veterinarian is in charge of diagnosis, prescribing, and surgery. And the veterinary nurse can really do everything else. So, like me as
Okay, so let's break that down a little bit, because I think that's super easy to glaze over.
Mhm.
The diagnosis, prescribing, and surgery. So this is where this is right. So this is what the actual veterinarian of the practice, and some practices have more than one vet, correct?
Yes.
Oh, yeah.
Right. So their responsibility is for sitting with the patient and then figuring out kind of what is wrong, making their interpretation of what's wrong. And then they prescribe what should happen next, right?
Yes.
And if that prescription involves surgery, then they perform the surgery. But your vet nurses / vet techs, they're doing all of the legwork outside of those actions.
Yes.
Yeah. So everything in between, yeah. And
so the veterinarian can come out of the room of talking with the owner and the animal, and then turn the animal over to the veterinary nurse to basically take care of everything. Then, draw blood for the workup with the, for lab work, and get an IV catheter set and start fluids and administer medications and watch that animal while they're hospitalized. And yes, if it needs a surgery, then they're the ones that are getting everything prepped and ready for surgery.
Gotcha. So what I'm hearing is that if your animal's going to be in the hospital for a few days, that the donuts need to be brought to the vet tech. Like, that's who you want to buddy up with.
We love junk food. Yes.
And I will make a push though for healthier snacks, because I'm all about the health and welfare of the veterinary nurses as well. So healthy treats would be great too.
Yes, we like our fruits too. Fruits, vegetables. Yeah.
On
we
top
still
of
like
cake.
Our junk food.
Like
yeah, we still like our
cheesecake.
junk food. Yeah. So, but yeah, Dr. Noreen is right in that, and of course it depends on your skill level as a veterinary nurse. For me, I've been literally, it's all I've ever known. It's what I do. So I have a lot of, base knowledge. I have a lot of extra knowledge that I've been able to acquire over the years. And so at some point, what really needs to happen is that you build this trust with your team, and that would be including your veterinarian, your technician or nurse, your assistant staff, and even your CSRs to help with communication. And so, but it's going to vary based on the trust between your team, so and the skill set that the team has. So it's going to vary, but ultimately it's not uncommon for a doctor to do their exam, discuss with the client the information. We're not only dealing with the preparation of diagnostic samples, collection of whatever else we need, like she said, IV catheter fluids, medication administration, preparation for surgery, but then we are also oftentimes, and especially in my setting, we're also doing a lot of the financial part of it. We're also going back in and explaining in the estimates, explaining to the families, this is what you're paying for, and giving you the value or helping you understand the value of the services that you're paying for. Because that's, I mean, if you get right down to it, again, going back to that part of it is families need to know what we're doing and why. And sometimes it's us that's doing that, because doctors will sometimes talk way up over their head and we're using big words. And so then you come back in, they're like, well, I just can't understand why I need to do this. And then you may be back there still, just it's communication. And that to me is one of the most important things that I hope to drive home to our students over the 2 years that they're with us is they have to have very good verbal and nonverbal communication skills, and realizing that is not about animals or just animals, but it's about the animal or the human as well. And it's like you said earlier, Jensen, was the human animal bond situation where pets are no longer just pets, but they are family, right? And I'm exactly right there with you. Like my dogs are with me 99% of the time. They sleep with me, they eat dinner with me, like they're my companions. And so I get that. But I also come from a generation where pets were still pets, lots of working dogs, cats live and die by the road kind of mentality. But anyway, again, just going back to this, helping the students understand that communication and the human interaction is sometimes, to me, more important than what we can do with the animals in the back, the stuff they can't see.
I mean, that's where you get your trust. I mean, that's where
exactly.
Like, in my opinion, if you can establish that connection with the parent of an animal that you have in the hospital,
Mm-hmm.
and you can build some kind of rapport and trust with them, even in a short amount of time. Like, it's nice if the parents are making their trips coming in, right, and building that rapport, but in that time, the amount of anxiety that you can bring down for them, knowing that they're with somebody that they know cares on the other side of that wall back there is like night and day, not just for them, but even for the staff up front, so that they're not getting angry phone calls and they're not getting, I can't even imagine some of the stuff that you guys have to deal with the parents that are like stressed out, like, okay, it's been 10 minutes, what's going on? Okay, it's been 10 minutes, what's going on? Over and over and over again. And I have a total amount of empathy for them, because that's a really, really difficult thing to go through.
Scary,
but at the same time, you're taking staff away from being able to help your animal in the back, and trying to find that balance. So I love that you guys have an emphasis on the human connection at the same time.
It feels really good when, you have a client say to you, you know what, I'm so glad you're here today.
Yeah.
And they know that when they walk out the door and they leave their pet with us, that they have, like you said, that comfort and the confidence and a little bit decrease of anxiety to make sure that, okay, I think it's going to be okay.
So what's the supply and demand in the industry right now?
Ooh, this is bad.
Yeah. Veterinarians, veterinary nurses are really in demand.
Yes.
Yeah. There is a burnout and a turnover. Per current articles, they say about half of veterinary technicians or veterinary nurses will burn out in the field within the first 5 years, and about 35% of them burn out at some point. So I think
so is that, do you think dealing with people or dealing with animals? Like if you had to, like, can we help the veterinary community more by being more understanding and knowing what's going on to prevent that burnout? Or is it just a reality of so many difficult decisions every single day dealing with animals?
There is a component,
And
especially
you guys can
for
be
the
honest.
veterinary nurse, that we need to increase the pay rate for veterinary nurses. They're not paid what they should be, considering the training that they have and the responsibility and the ability that they have. So there are some hospitals that realize and are trying to pay better salaries. But that's a component. Sometimes we have some of the old school veterinary hospitals where maybe the veterinarian is doing more than, they're doing more of the tasks that should be for the veterinary nurse. So, giving them the responsibilities that they're trained for and paying them appropriately. I think when you compare in human medicine, I always give the example where some people will shop around, they have a dog to get spayed. And then they might say, oh my gosh, that's costing, $600 or something. And can you imagine though, for a hysterectomy for a woman of how much that costs in the human field? So I think just kind of keeping in proportion of, the care that you're getting for your animal. And yes, it is going to come at a cost. And that then too, in some of our corporate practices, that the veterinary industry needs to be paying our support people better.
Yeah, very much so. Yeah. So, and to add to that is financial is a huge part of it. And we don't get into vet med to get rich, but we do need to make a livable wage and I would say if we did a real survey, I would bet that close to 50% of all support staff have one or more jobs, meaning that we all have some form of part-time job, like to make ends meet. And that sometimes is even true for the veterinarian because it is now considered a second income profession. So which gives you a real big eye opener in the sense of what the value is of these medical professionals. And then the other part of the burnout aspect is that we as people, again, I think it's the type of people who choose this field are very bad at setting boundaries. And we will work 12, 13, 14-hour shifts, work 60, 70 hours a week and keep going and keep going. And part of it is that, once you build that team and that trust between each other within the doctors and the support staff, that you don't ever want to let someone down, right? Sure. You're like, okay, we're short staffed. Maybe we have 14, 15 patients in the hospital. There's 4 of us in the hospital. If I go home, now there's only 3. Like, oh, I can work a few more hours until someone else comes on. That mentality, or never taking your breaks. We don't, in fact, in some places, it's obviously law to take your breaks, right, or you're supposed to, but if you took a survey of all of us, the reality is that many of us are working 12 or plus hours straight. We're eating on the go. We're lucky if we've gone to the bathroom once during that whole time. Like, we're not drinking enough water. We're just going. And so we don't take care of ourselves. It goes back to that kind of that self-care. We are really poor at that.
I will make a plug also for the career of veterinary nursing, as opposed to going the longer route to go to veterinary school, because the education for a veterinary nurse is still affordable. The education for a veterinarian has just gone through the roof. So
what does it cost to go through school?
So for us, you could get your entire education for basically $9,000.
Okay.
If you went the route of going to veterinary school, you could come out of vet school with a debt load of $300,000, depending. So with the increase of cost, though, for the veterinarian to go to school, the pay rate had increased then for veterinarians. So I want to see the pay rate increase for veterinary nurses because of everything that they do in a veterinary facility.
Mhm.
So what might be some of the solutions then? Because like I've heard all of this. So veterinary nurses are overworked, overstressed, underpaid,
Underpaid.
and in over demand. Like
Yeah.
like everything like that is just so cattywampus. Like everything's not matching up there. Like, what's the solution? Like, how do we fix that? Because I know, like, again, this show is not to make vets sound like evil. I'm sure that they're dying to find good vet techs, and there's a lot of good quality vets out there that are paying good wages and all of
Well,
that.
Absolutely. But I think even just getting the awareness out of what a veterinary nurse or veterinary technician is and what they do. Being in the field of education now for a while, I've encountered some students where they might want to do veterinary nursing, but then their family emphasis is, well, you've always wanted to be a veterinarian, ever since you were little. That seems to be what kids say. Oh, I want to be the animal doctor. And just knowing that there is an alternative, somebody that then is really trained in the field, still goes through continuing education, just like the veterinarian has to as a licensed professional, that's a standalone career, and that the awareness for the public that there is that career, and the hope that, yes, we do see hospitals that are increasing pay because they need to keep these professionals in their hospitals.
To me, it sounds like a fantastic entry point of, let's make sure I like this. I mean, if
Yes.
you're listening to this podcast and you hear that there's a high burnout rate, then like, but you still want to go through with this, like, please. But spending $9,000 and a smaller amount of time to get your feet wet, get involved in the community, and then make that decision to take the larger step after that. I mean, it sounds super logical to me.
I honestly, I would go even farther with that and advocate that they, before they go to school in any degree of this profession, that they spend as much time in a facility as possible. Even if they are cleaning kennels and dealing with vomit and poop and, barking dogs all day, that they see that before, because I think some people go in with these rose-colored glasses, and I've seen it over the years. I've had people beg me for, like, oh, this is what I want to do. In fact, this was years ago. And one girl, I hired her, and then the same day, my boss's daughter's cat had been attacked by a raccoon, and it was pretty beat up. Like, there were bones sticking out of places that shouldn't be. And she saw that, and that was her immediate realization. She's like, oh my God, I can't do this. So I think spending a little time volunteering in shelters is a good way, because you see the discarded pets. But also just either getting hired before, like doing some type of small assistant work, even if it's like going in and talking to clients, things like that, it helps you realize exactly what you're getting into, and so I do feel like you need to know what you're dealing with. And because in some levels, some people, they don't realize the repetition that we do a lot of the same things day in and day out. And like, for instance, a lot of people think emergency medicine is just super glamorous, and I always tell them it's like 80% routine stuff: vomiting, diarrhea, broken toenails, cuts on feet, things like that. And it's like this tiny little portion of what we call super cool medicine. Like, we're like, oh, we got to do X, Y, and Z today. This is great. So, but that's true in family practice. It's true in shelter medicine. It's true in all types. So just those realizations in general, I would say, just opening your eyes to really what the profession means, and whether or not you want to do it. I guess another example I have is, this isn't vet related, but my daughter, for whatever reason, wants to go to mortuary school. And so I'm like, don't go to school until you go and
The
experience
work
some
in
of
the
this stuff.
industry. Yeah.
Yeah, the work in the industry, because wow. And I think our fair profession kind of parallels that, in that you don't totally realize the good, the bad, and the ugly altogether.
Right. And for our program is a limited admission. So we have a certain number of seats, and then people apply for those seats. And one of the things, if somebody does not have experience working at a veterinary hospital for at least 3 to 6 months, that they get 50 hours of observation at a veterinary facility before they apply, so that they do get some basis of what this career is about.
Mm-hmm.
So why do you guys do what you do? Like, let's kind of wrap the show up with that, because we've spent a lot of time a little bit on doom and gloom, but I know how passionate you guys are both about what you do and the path that you've taken. So, I mean, there's obviously people out there that have this heart for animals that are going to go through, and we've met some. So like, why do you guys do what you do?
Do you want to start?
Well, for me, I became a veterinarian based on getting a rescue dog that led me down the path. At that time, the veterinary technicians weren't really the same emphasis as a career as they are now, because I went to vet school quite a while ago. And so I became a veterinarian. I went into private practice in Arizona, and I burned out pretty quickly. The long days, the stresses. And then when I moved to Reno, I was trying to balance that, not just go right back into practice. So I started helping at the local shelter or animal control. And I became a part-time, a contract vet for animal control. And then there was a student that was there that was in the vet tech program at the time. And it was an early on. Our program only started, our first class graduated in 2000, it was 2004.
Mm-hmm.
And I started in 2005. My dad taught community college his whole career. He taught economics. So I think it was a little in my blood then to be in the education system. And we help a lot of rescues because we have that passion as well in our program. But it's really rewarding for me to see the graduates and where they go and how their careers progress. And yes, some of them that go on to other careers, but it's kind of being able to help animals still, but by helping the people that are going to help the animals. So that's why I've been in this profession of education for as long as I have.
Love it.
I think for me, like I said, I grew up in the field. I also grew up with a very animal heavy family. We raised hound dogs, and we had at any given time like 15 or more. So like totally
15 or more
immersed.
hound dogs around.
Yeah.
Like, that is a loud house.
It's a loud,
a
lot of noise.
And so as you can imagine, like I've fully been immersed. And I think the pivotal thing for me was one time we had a Sheltie who she whelped her puppies in the closet of my bedroom, which is, she just randomly chose that spot. And like watching that experience and seeing her care for them and the development of the puppies and the growth. And that was like, I think, a real big stick to me in my mind. And then I ultimately, by some stroke of life, ended up living next to a vet hospital. And so when I was very young, I was cleaning cages, mopping floors, walking dogs, doing the dirty work. And I stayed with that practice for 13 years. And for me, it was as much the love of the people, not just my coworkers, but my clients, like my people. It was as much about them as it was their animals. And in companion animal, like in family practice, you do form this bond, this relationship. Like you get to know people, you watch them grow, you watch their pets grow. Sometimes you're watching their children grow. And then their kids are coming to bring their pets in now,
Sure.
like that kind of thing. And then after that, after that many years, I really was starting to struggle with what do I do next? I felt like I had plateaued a little. That's when I ended up getting my LVT, which was in the early 2000s, which is licensed veterinary technician. And then I was really fortunate to work with a doctor who recognized that I needed to do something more. I was going to leave the field. I was actually in dental hygiene school. And he said, hey, you know, there's a specialty in dentistry. And he's like, would you like to pursue that? And so my practice then helped support my movement for specialty into dentistry. So I essentially became a doggy hygienist. And so the neat thing about that is that I was at that burnout point. I was at that realization where I either had to find something new or become leadership or management. And that's definitely not my gig.
Mhm.
So having that ability, that prolonged my career for another like full-time practice for almost another 14 years. And I stayed
Wow.
with the same doctor there. So so you asked earlier, just, I'm sorry, this is a small tangent, but you said, how do we keep our technicians? And one is to support growth. I think that's huge. Support growth and development, and don't let them become stagnant, because that's what is a big killer of making people not want to stay. Is just that part of it. So I was fortunate in that. And then I've always been an educator. I have been very fortunate to do this on a informal platform for probably 10 years, and then part-time at the college for a long time. And then when the opportunity opened up to become a full-time educator with the college, I couldn't say no, because this is what I love and the reason that I'm here. And I wouldn't keep teaching students if I didn't believe that it was worth their while to move forward.
Love it.
Yeah.
Love it. Love it. Well, I'm assuming anybody that's interested in talking to you guys directly about signing up with the program or has more detailed questions, they could reach out to you guys directly.
Absolutely.
Yeah, if you go to the Truckee Meadows Community College, so tmcc.edu, the website, and put in the search bar veterinary nursing, comes up with information about the program and a way to contact us.
Love it. Love it. Love it. Well, I've enjoyed having you guys on today. Like, honestly, I feel like I probably have another 2 or 3 hours worth of questions that we could totally dig into. We'll have to have you guys back on again to talk about some of that. But like keep
Thank you.
keep
Thank you
doing
for
what you guys are doing. Like
Yes.
it's amazing.
Thank you for bringing awareness to the field of veterinary nursing, veterinary technicians. And we have a great new campus site where we have space for all of our needs for education that looks so much more beautiful now because of the photos.
I was going to say,
yes.
I might have
thank
some more
you.
stuff for you guys too. So we'll bring that over too.
We have
Okay.
space, so
Good.
thank you.
Yeah. And it's so nice. It's so warming to have those photos in when we come in every day. So we really
Yeah.
appreciate you sharing
Yeah.
them with us.
Love
They're
it.
beautiful. They touch
Love it.
everyone.
Well,
So
thank you guys so much.
Thank you, Jason.
And we'll talk again soon.
Okay.
Okay.
Thank you.
Bye.
I just want to take a quick second and thank everybody for joining us today. I want to give an extra big thank you to both Julie and Michele for opening up and sharing what drives them to be a part of the veterinary community, some of their experiences and everything like that. There was definitely some chords that, that struck home. My parents had to go through an experience of losing one of their dogs, and they have some connections to that. So there's a closeness that I have with these women, and it was great having them on the show. Make sure to follow them. If you have any questions about becoming a part of the program, reach out to them directly. We'll list the program in the notes. As always, make sure to give them a follow. And if you're not already subscribed, make sure you subscribe to the Dogish podcast. And lastly, if there is a topic, personality, or event that you would love for us to have on the show, don't be afraid to reach out or make a suggestion and let us know what they are. Until next time, I know you're all missing Sylvia deeply, and she will be back on the next show. But from me, thank you, goodbye, and we'll talk to you soon.